Welcome to all NORCET aspirants to my educational YouTube channel, Master Nursing Classes. Here we are discussing regarding very important topics related to neurology, that is in integrated session for neurology for your NORCET examination. Okay, so as I uploaded my part 6 and part 5 video yesterday, so this is our part 7 video. In previous classes I have explained very important topics related to spinal cord. So arrangement of the nerves in the spinal cord, number of spinal cord, each and every points from one liners to uh, next level questions I have discussed there, the important concept. Okay, so in today's class we will discuss regarding the very important topic, that is the cranial nerve. Okay, so cranial nerves we will discuss today. In each and every exam there should be a question on the cranial nerve. Okay, there should be a question on the cranial nerve. So we will study the cranial nerve in detail, from where it origin. So from here it supplies, what is the sensor nerves, what is motor nerves, what is mixed nerves. So each and everything we will study in detail regarding to cranial nerves. Okay, so without wasting the time we will move to our important session, that is cranial nerves. In that one we will study from what is the meaning of the cranial nerve. We will study first. See, in yesterday's class we have studied the important topic, that is the spinal nerves. Okay, from the spinal cords, where from the spinal nerves are origin, that is called our spinal nerves. Okay, spinal nerves are which are comes from the dorsum part, those are sensor nerves. Which it comes from the ventral part or ventral root, that is motor nerves. And all spinal nerves mixed together, the all spinal nerves are the mixed nerves. Okay, this topic in detail yesterday class we have discussed in detail. Okay, so the nerves which are originating from the spinal cord, those are called spinal nerves. Simply, the nerves which are originating from our brain and cranium, those are called cranial nerves. Okay, those are called cranial nerves. Here is the important points where I mentioned that origin of the cranial nerves occurs from the brain stem. Okay, occurs from the brain stem. Very very important point for your NORCET examination. Okay, this is the beautiful structure of our brain stem. Here I have drawn. So before knowing going to this topic, we will study some simple trick in this one, base for our brain stem. So this is my brain stem. See, this is the beautiful structure of the brain. So from brain, lower part of the brain, here it is the origin of the our brain stem. This is called midbrain. Here I have mentioned, and this is our pons. Okay, and this is the medulla oblongata, including all the three parts. I have mentioned many times that brainstem having the three components, that is the midbrain, pons, and medulla oblongata. From here, our cranial nerves get originates. Okay, uh, we will see which are the nerves originates from the brainstem. Okay, cranial nerve third. We are having total 12 number of the cranial nerves. Among those, 10 cranial nerves originates from the our very important brainstem. Okay, two cranial nerves are not having any kind of nucleus, and they are not originates from the our brainstem. Okay, see what we call this one. This is our cranial nerve body, and here is the elongation nerve fiber of our cranial nerve. Okay, so this is called cranial nerve body or nucleus. Okay, we call this one as nucleus, and this is our nerve fiber. Okay, okay, this is our nerve fiber, and this is the nucleus. These nucleus present in the very important our cranial nerve. Cranial nerve nucleus very importantly present in our brainstem. Okay, our brainstem. So cranial nerve first and second are the nerves. They don't have any kind of the nucleus. Okay, ಒಂದನೇ ಮತ್ತು ಎರಡನೇ cranial nerve ಯಾವುದೇ ತರಹದ ನ್ಯೂಕ್ಲಿಯಸ್ ಇಲ್ಲ. So 3 and 4th cranial nerves, they originates from the very important points from midbrain. Okay, from the midbrain. It originates from the our midbrain. Okay, very important point. And cranial nerve number 5, 6, 7, and 8. These four nerves originates from our pons. Okay. And 9, 10, 11, 12. These four cranial nerves originates from our medulla oblongata. Okay. Very important points. First two cranial nerves, nerve number 1 and 2, not having any nucleus. Nerve number 3, 4 originates from our midbrain, and pons origin 4, 5, 6, sorry, 3, 4 from midbrain, 5, 6, 7, 8 from the very important point from the pons, and uh, 9, 10, 11, 12 originates from our medulla oblongata. Very important point. Okay. So examiner may ask the question from here. So from which part the facial nerve originates? Okay. So facial nerve is cranial nerve number 7. So 7 is originating from the pons. Okay. 7 is originating from the pons. Okay. You can say the answer is pons there. Like that. Okay. Very important point. So next we will move for the cranial nerves. So total number of the cranial nerves are 12 pairs. So I have told one trick in previous class to remember 1, 2, 3 and again 1. Okay. Total number of the cranial nerves are 12 and total number of the spinal nerves are 31 pairs. Both are in pairs. Okay. This is also in pair. This is also in pair. Spinal nerves are 31 pair. Cranial nerves are 12 pairs. Very important. Okay. So to remember total 12 number of the cranial nerves, there are many mnemonics are there. Okay. There are 1000 plus mnemonics are there, and you can, if you are already having the mnemonics to remember the total 12 number of the cranial nerves, so no need to change your mnemonic because already that is present in your brain. It's already fit for you. Okay. So if you are not having any mnemonic, means I have made one mnemonic for you uh, describing the all 12 number of the cranial nerves. Okay. So I will mention here the first singular words. See, one person is looking at one bike and he is saying that oh, 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 to touch and feel very good vehicle is Honda. He is telling. Okay. How many numbers? 12 numbers total. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. O, to touch and feel very good vehicle is Honda is telling. Okay. So O stands for olfactory nerve. First comes our olfactory nerve. That is this responsible for the smell. Okay. Then again comes for second one is our optic nerve. Okay. Optic nerve. Third one is our oculomotor nerve. That is responsible for the movement of our eyeball. Okay. Optic nerve is responsible for the vision. That only supplies the sensory neuronal layer of our eye. That is the retina. I will explain in detail each and every nerve in detail in next slides. Okay. So very important. And oculomotor nerve is the responsible for our eye movement. See, my eye is moving like this. For this, vision nerve is responsible. Oculomotor nerve is responsible. Okay. And trochlear nerve is also responsible for our very important eye movement only. Okay. There are three nerves which supplies the eye muscles, that is the extraocular muscles of the eye. I will discuss those three muscles together, those three cranial nerves together for a very easy remembering. Okay, next let's. Okay, here touch stands for the trigeminal nerve. Okay, touch stands for the trigeminal nerve, and stands for the abducens nerve. Feel is facial nerve. Okay, F to F facial nerve, and very importantly V stands for the very stands for the vestibulocochlear nerve, and G stands for glossopharyngeal nerve, V stands for vagus nerve, that is cranial nerve number 10, and 11th is spinal accessory, 12th is hypoglossal nerve. Okay, very important. You can uh, remember the mnemonic as O, to touch and feel very good vehicle is Honda. Okay, you can write and practice this one. Okay, very easy. And some nerves are sensory nerves and some nerves are motor nerves and few nerves are mixed nerves. In order to remember that, so I will tell one tricks. Just remember that one. First two cranial nerves are sensory nerves. Okay. sensory nerves. First two are sensory, second two are motor. Okay, four we completed, and last two are also motor. See, last two are motor. Out of 12, six we have remembered easily. First to sensory, second to motor, and last to motor. From going from last, two nerves are mixed nerve. Okay, motor, mixed. Okay, and sensory, motor. Here is the first to first for sensory, motor. Last for mixed. Last for are sorry, motor, mixed. Total eight completed, and among this, next comes the mixed motor, mixed sensory. Okay, mixed motor, mixed sensory. I will write here. Okay, for your easy remembering. First two are sensory. Last two are motor. Then again, second, third, and fourth cranial nerves are motor, and these two are mixed, and here it comes a very important point, that is mixed motor and mixed sensory. Okay, mixed motor and mixed sensory, very important. Means our olfactory nerve is sensory nerve, optic nerve is sensory nerve, and oculomotor nerve is motor nerve, trochlear nerve is motor nerve, trigeminal is both. Okay, mixed nerve, that is both sensory and motor nerve, and our very important abducens is motor nerve, and facial is mixed nerve, vestibulocochlear is sensory nerve, and our very important glossopharyngeal nerve is mixed nerve, and vagus is mixed nerve. Spinal accessory is motor nerve. Yes, very good. So, and last hypoglossal nerve is motor nerve. These are the 12 pairs of the cranial nerve. You have to remember that originates from our cranium. Okay, from our brainstem. Okay, among these, so first two cranial nerves are not having any kind of a nucleus in the brainstem. Okay, no nucleus, and rest all are having nucleus. Among these two from very important point, midbrain. Okay, and these four. Okay, from our pons, and last four from the very important point, medulla oblongata. Okay, so we'll move for the forward classes. So next comes this one. Okay, very important. First cranial nerve we will study in detail now. So I have told the cranial nerve number 1, that is our O stands for, that is olfactory nerve. Okay, that is olfactory nerve, very important. Cranial nerve number 1, that is olfactory nerve, that is responsible for smell. Okay, when you are passing beside of the, when good restaurant, means you will get smell from there, some coffee smell, some food smell, and some lemon smell, some fruit smell. Okay, you will get. So the sensory smell you are getting, that is because of your olfactory nerve. Okay, that is because of your olfactory nerve. Olfactory nerve doesn't do any motor function, not responsible for any movements in our body, only responsible for taking the smell. That is our cranial nerve number 1, that is the olfactory nerve, that is pure sensory nerve. Okay, pure sensory nerve, no any motor function, only sensory function. So that is the pure motor nerve. And I have told first two cranial nerves, cranial nerve number 1 and second, not having any nucleus, so no nucleus. Okay, how we will examine this cranial nerve number 1, that is the olfactory nerve, is we will ask the patient to close his eyes. Okay, close his eyes, and in one place we will keep 4 type of the different smells. So we will expose the patient to that smells, and we will ask the patient to describe which smell it is. Okay, which smell it is. If he is not getting any smell here, means that is called very important term, that is anosmia. Anosmia means loss of smell sensation, that is called anosmia. For your NORCET point, keep in your mind. Okay, loss of the smell sensation is called anosmia. Okay, when we are exposing that patient to coffee smell, okay, to coffee smell, and he is telling that is some metal smell, okay, that is some metal smell, means his sensory function is altered, smell sensation is altered. He is getting some smell, but he is not getting what it is exactly. We are showing some, we are exposing him to some coffee smell, he is telling some metal smell, means so his having the altered smell sensation, that is called pasosmia. Okay, very important word, pasosmia. Okay, examiner may confuse you with this word. Okay, altered smell sensation is called pasosmia. This occurs due to the some damage in our olfactory cranial nerve. Okay, very important points. That is the olfactory nerve, responsible for the smell. Only pure sensory nerve, it doesn't have any nucleus. So alteration in the function of the olfactory nerve, and which leads to loss of the smell, is called anosmia, and alter the smell sensation is called pasosmia. Okay, very important. Next we will move for the very important nerve of our body, which is responsible for the vision. Okay, which is responsible for the vision. Whatever you are seeing in your YouTube screen, you are seeing because of the your normal function of your cranial nerve number 2, that is the optic nerve. Okay, see, that is the optic nerve. This nerve is only responsible for the vision, not to responsible for any movement of the eyebrows, movement of the eyeballs. Okay, for movement of the eyeballs, there are three separate cranial nerves are present. Those are the pure motor nerves. I will explain that motor nerves in next classes, in next slide. Okay, this optic nerve 2, optic nerve means the cranial nerve number 2 is only responsible for the vision function, that is the pure sensory nerve. Okay, it is pure sensory nerve. So function is the only responsible for the vision. Okay, and sensor nerve is sorry, it is pure sensory nerve. Okay, and this is cranial nerve number 2, and I told already this is also not having any kind of the nucleus. Okay, see where it gets supplies. It supplies, see, I will draw on structure of eye here. This is the outer part of our eye. Okay, that is called sclera. Okay, and here it comes our middle part of our eye with uveal tract. Okay, that is called our, which layer, this one? Yes, very importantly, choroid layer. And here it comes our very important inner sensory neuronal layer of the eye, that is the retina with depression, that is called fovea centralis. Very important for our examination. Okay, this is the sclera, this is the choroid, and here it comes our very important inner layer of our eyeball, that is called retina. Okay, retina. So this sclera doesn't having any optic nerve supply, and choroid also not having any optic nerve supply. Only retina is having the optic nerve supply. Okay, from only retina, optic nerve is having the supply. Okay, from here it goes to the our occipital lobe of the brain. From at that point our vision is pursued. Okay, very importantly, so this nerve is called optic nerve. Okay, this nerve is called optic nerve, and which supplies the inner layer of our eye, that is called sensory neuronal layer, and that is called very importantly retina. Retina is our innermost third layer of our eye. Okay, first one is the sclera, second one is choroid. Okay, first this one is sclera, and here this one is the choroid, where our blood supply is there, that supports the blood supply of the retina also. Very importantly, while explaining the structure of the eye, I will explain in detail each and everything. Just I am creating base here for your optic nerve study. Okay, So here it comes our optic nerve from area where it comes inside, that is called blind spot. Okay, that is called blind spot. Very importantly. Okay, so we will see how our optic nerve is supplied. I told already there. So here it comes our innermost layer of our eye, that is called retina. From the retina, optic nerve is coming like this. Okay, optic nerve is coming like this, and right optic nerve is coming left side, and left optic nerve is going right side. From here, the both nerves are crossing. That point we call optic chiasma. Okay, optic chiasma, very important. What is the optic chiasma? Optic chiasma is the point from where right cranial and right optic and left optic nerve is crossing in our very important point part where in our thalamus. Okay, that is called optic chiasma. Okay, and here it comes our optic tract, and very importantly, this is our lateral geniculate body. So we are having two important geniculate bodies in the brain. That one is the lateral and another one is the medial. Okay, so lateral geniculate body is responsible for the vision. Okay, and medial geniculate body is responsible for the music. How to remember this one, sir? L say L. You can remember lateral is for light. Okay, light means the vision. Okay, lateral geniculate body is responsible for the light, that is the vision, and medial geniculate body is responsible for the music. Okay, music, that is the median geniculate body. So that is responsible for music means that is responsible for hearing. Okay, lateral geniculate body is for vision and medial geniculate body is for hearing. Very important point for your knowledge. And here it comes our optic radiation, like this it will comes, and here the visual cortex of our occipital lobe. Okay, we will get perception for our vision. Very important point. From this slide, one question will arise in your NORCET exam. Keep remembering, innermost or sensory neuronal layer of the eyeball is retina. That is the innermost layer where it containing the optic nerve supply. Okay, and from which area optic chiasma is present means, in which area optic chiasma is present means it's present in the thalamus, and the two optic nerves are crossing each other like this. So at that area, what we call, that is called optic chiasma, and in which body it radiates, and responsible here for vision is the lateral geniculate body. Okay, from here it get radiates, and in which lobe of our bone the vision is perceived means, that is the occipital lobe. I have explained this occipital lobe while studying the functional areas of the brain. Okay, please do visit that video after this class. You will get very much clarified. Okay, uh, we'll move forward to our next topic, that is the very important nerve, oculomotor nerve. Okay, so 1 minute before going to oculomotor nerve, I want to explain this. See, our eyeball is there. So our eyeball is moves in all direction: right, left, downward, upward and outward, inward and upward. Okay, and this one, very importantly, inward and downward, outward and downward. Okay, all this area our eyeball rotates. Means our eyeball is surrounded by the very important muscles. Those all are called extraocular muscles. Okay, extraocular muscles. Okay, extraocular muscles which are responsible for our eyeball movement. Okay, these extraocular muscles is supplied by the three cranial nerves. Three cranial nerves, very importantly. Okay, for moving our eyeball, how many nerves are responsible means three cranial nerves. Okay, I will tell which are those three cranial nerves and what is the function of this those three cranial nerves. Okay, we are having the muscles name like superior rectus, which is present upward, and inferior rectus down, medial rectus here, and lateral rectus outward side. Here it comes up 4 rectus muscles, okay, and 2 oblique muscles. That is the superior oblique muscle and inferior oblique muscle, okay. Superior and inferior oblique muscle, 2 oblique muscle, 4 rectus muscle. Total we are having the 6 extraocular muscles. Among those, our first cranial nerve, that is cranial nerve number 3, which supplies the 4 extraocular muscles. Among 6, how many extraocular muscles it's supplying? It's supplying to the 4 extraocular muscles. That is called oculomotor nerve. Means oculo means related to the eye, motor means related to the movements. So eyeball, the nerve which is responsible for the movement of the eyeball is oculomotor nerve. Okay. Uh, this nucleus of this oculomotor nerve is present in the midbrain. Okay, and responsible for the movement of the eyeball. I have explained, and supplies the extraocular muscles except the 2 muscles, that is lateral rectus muscle and superior oblique muscle. Okay, superior oblique and lateral rectus muscle. This lateral rectus muscle is supplied by the 6th cranial nerve. Okay, and our this superior oblique muscle is supplied by the 4th cranial nerve. Okay, total 3 cranial nerve supplies. That is the to the extraocular muscle. That is cranial nerve number 3. Okay, cranial nerve number 4 and cranial nerve number, very important, yes, 6. Okay, these 3 cranial nerves supplies our extraocular muscles and responsible for the movement of our eyeball. Okay, so our 4th cranial nerve which supplies the only one muscle, the extraocular muscle, that is the superior oblique. So you can remember is as this one as an SO4. Okay, and our last sixth cranial nerve which supplies to our lateral rectus, you can remember this one as LR6. Okay, LR6, very important. So this is our extraocular cranial nerve number 3, oculomotor nerve, which is responsible for the supplying the, okay, superior rectus muscle is supplied by which nerve? I will clarify first which all are not supplied by the oculomotor. SO4, that is the superior oblique, is supplied by the 4th cranial nerve. Okay, which is supplied by the 4th cranial nerve. Okay, and our lateral rectus is supplied by the 6th cranial nerve. Okay, rest all nerves are supplied by our 3rd cranial nerve. That is the superior rectus is supplied by 3rd cranial nerve. Medial rectus is supplied by the 3rd cranial nerve. Okay, inferior oblique is supplied by the 3rd cranial nerve, and inferior rectus is supplied by the 3rd cranial nerve. Okay, very important point for your NORCET examination. Okay, so we have seen that 3 cranial nerves which are responsible for the extraocular muscle supply, so which is responsible for movement of our eyeball. Okay, so which nerve rotates our eyeball in which direction? That is the question which is asked in your last aims. So that is very important. This superior oblique muscle is supplied by the cranial nerve number 4. Okay, that is our trochlear nerve. Okay, trochlear nerve. Okay, which is responsible for the downward and outward movement of your eyeball. Okay, downward and outward movement of your eyeball. That is the cranial nerve number 4. Okay, cranial nerve number 4, very important. And this our lateral rectus is supplied by the cranial nerve number 6, which is responsible for the lateral rectus. The nerve itself saying that lateral, and rectus means direct. See, which is responsible for the lateral movement of our eyeball. That is the lateral rectus. That is the cranial nerve number 6. Okay, and that nerve name is abducens nerve. Okay, abducens. Abducens. We can remember abduction. Abduction means away from the body. Adduction means towards the body. So lateral means away from the body is supplied by the abducens nerve. Very important, you can remember. Except these two movements, all movements of our eye is responsible for our cranial nerve number 3, that is oculomotor nerve. Okay. Only downward and outward movement is responsible for trochlear nerve, and for the lateral movement, the cranial nerve responsible is abducens nerve. We can remember. Rest all movements like upward movement, cranial nerve number 3, that is oculomotor, and for downward movement, cranial nerve number 3, that is our oculomotor, and inward movement, cranial nerve number 3, that is oculomotor, and upward outward movement, that is the cranial nerve number 3, that is our very important oculomotor nerve. Okay, only downward outward. Okay, only downward outward trochlear nerve, and only lateral, that is very important, abducens nerve. Okay, keep in your mind, very important questions. Again, there is a chance to ask in your exam. Okay. Next, cranial nerve number 4, that is the trochlear nerve. Okay, trochlear nerve, previously I have told, which is also a purely motor nerve, which is responsible for the eyeball movement. Okay, which eyeball movement? Downward, outward. Okay, very important. I have mentioned here. I mentioned as a 5-star question for your NORCET examination. Okay, trochlear nerve is responsible for the downward, outward movement of our eye, which supplies the which muscle? Superior oblique muscles. You can remember with the tricks of SO4. Okay, and which is the smallest cranial nerve? Means that is our trochlear nerve. Okay, trochlear nerve is the smallest cranial nerve. Very important point. Okay, and abducens also have studied. Before studying to fifth, we will study sixth, because this is also responsible for our eyeball movement. Okay, total 3 cranial nerves responsible for eyeball movement. Okay, uh, you will see in slide. Okay, this one. Total 3 I have told already. For superior oblique 4, and for lateral rectus 6, that is the abducens, and rest are our oculomotor. Okay, so abducens is the 6th cranial nerve, which is responsible for the supplying the extraocular muscle, that is the lateral rectus muscle. Total we are having 4 rectus and 2 oblique muscles. Among those, lateral rectus is supplied by our abducens nerve. Okay, abdu means abduction, means away from the body means laterally. Okay, is responsible for the lateral rectus muscle supply, which is responsible for the lateral movement of our eyeball. This eyeball, that is called our abducens nerve. Very important for your NORCET examination. So this is also 3-point question. Okay, very important. You can remember with the tricks LR6. Okay, LR6 means 6th cranial nerve is responsible for supplying the our lateral rectus muscle, and which is responsible for our lateral vision. Okay, very important point. Keep in your mind. And we have seen the first cranial nerves, that is our olfactory. Second, that is our optic. Third, that is our oculomotor. Fourth, that is our very good trochlear. And fifth, that is our trigeminal nerve. We will study now. Before studying the fifth, we have studied the 6th nerve, because which is also responsible for the eye movement. So I have cleared your topic here. Okay, so and we will now we will see the 5th cranial nerve, that is our very important trigeminal nerve. Okay, trigeminal. What is the meaning of the tri? Tri means 3. Okay, the nerve which is having the 3 branches. Okay, that is called trigeminal nerve. Okay, trigeminal nerve. So among 3 branches, 2 are sensory. Okay, 2 are sensory, and 1 is mixed. Okay, so here it comes our trigeminal nerve, which is responsible for the supplying our space as in sensory and motor nerve. Where it supplies, it is having an ophthalmic branch, that is the supplies for our sensory function of our eye, and one is maxillary branch, that is sensory function of our maxilla, and one is our mandibular branch, that is responsible for the motor function of mandible. Okay, You are chewing the food. That this means you are chewing the food means your trigeminal nerve, that is the third branch of our trigeminal nerve, motor branch, that is mandibular branch is very much normal. So that's supplying your muscle of mastication. So you are chewing it normally. Okay. So we are having the three branches in the trigeminal nerve. Okay. Tri means three branches here. Among two are sensory. You can remember O maxi. O maxi, you are sensational. Okay. O maxi, you are sensational. So sensory nerve. That is the ophthalmic and maxillary nerve are sensational. Okay. And our mandibular nerve is motor nerve. Very important, which supplies our muscle of mastication and which is responsible for our chewing movement. Okay. Very important. And if the examiner want to ask the question means largest cranial nerve is, largest means we can say the answer as in trigeminal nerve, and longest cranial nerve if examiner asking means you can say the answer as in vagus nerve. And examiner is not mentioning cranial nerve, only is asking the largest nerve of our body. He is asking means that comes to our sciatic nerve. Okay, that comes to our sciatic nerve. Very important. Okay, we will move forward here. Very importantly, I told first branch is our ophthalmic branch. Okay, which is pure sensory. Okay, it supplies our upper eyelid, lower eyelid, okay, and eyebrow for only sensory function, not motor function. Okay, motor function is regulated by the facial nerve. Okay, and sensory function here which is regulated by our very important, yes, ophthalmic branch of our trigeminal nerve. Okay, and if it is giving sensory function means here, so when we touches this part, it closes the eye. So blinking response is which nerve is taking part in blinking reflex means that is corneal blinking reflex. You can say trigeminal nerve also as an answer. Okay. uh, Next one is our very important maxillary, that supplies the sensory nerve, very important for our upper lip, lower lip, and like outer part of our nose, sensory function. Okay, very important. Third one is, that is our mandibular branch, that is responsible for our motor function. This is the very important point here. Okay, motor function is responsible for chewing the food. Okay, chewing the food, that is called mastication. Okay, mastication means the chewing. So the which branch of the trigeminal nerve is supplying to muscle of the mastication means we can say mandibular branch of the trigeminal nerve is supplying for the muscle of the mastication. Okay, if there is any damage to this trigeminal nerve means any damage to these three branches, so that is called very important your medical surgical topic, that is trigeminal neuralgia. Okay, what is the neuralgia? Neuralgia means nerve pain. Okay, that is your very important trigeminal neuralgia. Okay, algia means the pain. Okay, neuralgia means pain. Arthralgia means the pain of your joint. Algia means the pain. Okay, so here it is the nerve pain. So we call that is the neuralgia. Due to the damage of the trigeminal nerve, we are getting the nerve pain. So we call that is the trigeminal neuralgia. Examiner want to ask the question there, which nerve is getting, which cranial nerve is damaged. So you can getting the trigeminal neuralgia means your answer goes to the our trigeminal nerve, that is our very important fifth cranial nerve. Okay, fifth cranial nerve. So you are getting the trigeminal neuralgia. One Bollywood superstar is suffering from this one, and he have cured it successfully. That's our Salman Khan sir. Okay, so next very important points, we will move on to next slide. That is our seventh cranial nerve, because sixth cranial nerve abducens we have discussed the previous slide only, that is responsible for your eyeball movement. Okay, and our very important seventh cranial nerve comes here. So seventh cranial nerve also and mixed nerve. This is also having the two branches, sensory branch and motor branch. So sensory and motor is, both are there, means that is mixed nerve. Okay, so where it's supplying the sensory branch, see here it is your beautiful mouth. Okay, and here is your tongue. Entire two-third part of your tongue is supplied by, very important point, entire two-third part of your tongue is supplied by the facial nerve. Okay, and posterior one-third. Okay, posterior one-third is supplied by, very important, that is your glossopharyngeal nerve. Okay, that if the examiner tells and he gives the history in the question like this, while assessing the taste of the patient is not getting the sensation or the taste in entire two-third of the tongue. So which nerve get damaged means there is a damage of the our sensory part of facial nerve, that is responsible for taste of the entire two-third part of our tongue. Okay, and if he is not getting any sensation in the posterior one third of the sorry posterior one third of your tongue means, so which cranial nerve got damage means there is a damage of the glossopharyngeal nerve. Okay, very important point. So it is, this is our sensory branch of our facial nerve, which is responsible for supplying the entire two-third of the tongue and which is responsible for the taste. Okay, very important. And where is our motor branch will get supplies means, our motor branch supplies the entire facial muscles and movement of our facial muscles. See our wrinkling we are doing means that is due to the motor function of our facial nerve. And okay, and we are doing power sleeping like this means, so this is also responsible for motor nerve. Okay, if in any damage in the motor branch of the facial nerve, okay, there is one important medical term, medical surgical question comes here, that is the Bell's palsy. Okay, Bell's palsy, that is also called as in the facial palsy. Okay, that is also called facial palsy, very important. So ಪ್ಯಾರಲೈಸಿಸ್ ಆಗಿದೆ ಅಂತ ಹೇಳ್ತಾರಲ್ಲ, ಆ ಮುಖದ ಪ್ಯಾರಲೈಸಿಸ್ ಆಗಿದೆ ಅಂತ ಹೇಳ್ತಾರಲ್ಲ, ಅಲ್ಲಿ ಯಾವ್ದು ನರ್ವ್ ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ ಅಂದ್ರೆ ಅವತ್ತೊಂದು ಕ್ರೇನಿಯಲ್ ನರ್ವ್ ನಂಬರ್ 7, that is facial nerve got damaged, that is called Bell's palsy ಅಥವಾ facial palsy. Okay, Bell's palsy ಅಥವಾ facial palsy, very important. Okay na? So when the patient is suffering from the facial palsy means he is unable to wrinkle the brow. Okay, like this he unable to do. Okay, and his eyelid is drooping downwards. Okay, and his inability to close the eye completely, that makes your very important point your NORCET examination. His eyes unable to close means, okay, his eyes is unable to close means his eyes is completely exposed to environment, even the patient is in sleeping. Okay, continuously exposing to the environment, the anterior part of our eye, that corneas get damages, that's called corneal ulceration chance, or there is a 100% chance of the zero ophthalmia means, zero means dry, ophthalmia means eye. Okay, dry eye ಆಗುವಂತ ಚಾನ್ಸ್ 100% ಇರುತ್ತೆ, ಮತ್ತು ಕಾರ್ನಿಯಲ್ ಡ್ಯಾಮೇಜ್ ಆಗ್ಬಿಟ್ಟು ಕಾರ್ನಿಯಲ್ ಅಲ್ಸರೇಷನ್ ಆಗುವಂತ ಚಾನ್ಸ್ 100% ಇರುತ್ತೆ. ಸೊ ಇಲ್ಲಿ ನರ್ಸಿಂಗ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಬಂದ್ಬಿಟ್ಟು ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ close the eye with wet gauze pad. Very important. ಇದೇ ತರ ಇನ್ನೊಂದೆಲ್ಲಿ ಓದ್ತೀವಿ ಅಂದ್ರೆ ನಾವು ಹೈಪರ್ ಥೈರಾಯ್ಡಿಸಮ್ ಓದುವಾಗ ನಾವು ಒಂದು ಸೈನ್ ಸಿಂಪ್ಟಮ್ ಓದ್ತೀವಿ. ಅದರಲ್ಲಿ ಎಕ್ಸಾಪ್ಥಾಲ್ಮಿಯಾ ಅಂತ. ಎಕ್ಸಾಪ್ಥಾಲ್ಮಿಯಾ ಅಂತ ನಮ್ದು ಐಬಾಲ್ಸ್ ಪ್ರೊಟ್ರೂಡೆಡ್ ಔಟ್ ಆಗಿದ್ರೆ ಅದಕ್ಕೆ ಎಕ್ಸಾಪ್ಥಾಲ್ಮಿಯಾ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಆ ಕಂಡೀಷನ್ ಅಲ್ಲೂ ಪೇಷಂಟ್ ಗೆ ಐ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಕ್ಲೋಸ್ ಆಗಲ್ಲ, ಯಾಕಂದ್ರೆ ಐಬಾಲ್ ಐಲಿಡ್ಸ್ ಹಾಫ್ ಬರ್ತವೆ, ಇನ್ನು ಪಾರ್ಟ್ ಆಫ್ ದ ಐ ಎಕ್ಸ್ಪೋಸ್ಡ್ ಇರುತ್ತೆ. ಅವಾಗ್ಲೂ ಪೇಷಂಟ್ ಐ ಎನ್ವಿರಾನ್ಮೆಂಟ್ ಕಂಟಿನ್ಯೂಸ್ ಎಕ್ಸ್ಪೋಸ್ ಆಗೋದ್ರಿಂದ ಅಲ್ಲೂ ಡ್ರೈ ಐ ಆಗ್ಬಿಟ್ಟು ಕಾರ್ನಿಯಲ್ ಅಲ್ಸರೇಷನ್ ಆಗುವಂತ ಚಾನ್ಸ್ ಇರುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ನಮ್ದು ನರ್ಸಿಂಗ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಏನಾಗುತ್ತೆ, ವೈಲ್ ಟೀಚಿಂಗ್ ದ ಪೇಷಂಟ್ ವಿತ್ ಎಕ್ಸಾಪ್ಥಾಲ್ಮಿಯಾ ಇನ್ ಹೈಪರ್ಥೈರಾಯ್ಡಿಸಮ್ ಇಸ್ ಆಲ್ಸೋ ಕ್ಲೋಸ್ ದ ಐ ವಿತ್ ವೆಟ್ gauze pad, so there is decreased chance for the corneal ulceration. Okay, so very important point. And patient is unable to pop the cheek symmetrically. Okay, and he is smiling asymmetrically. See, while smiling like this, our both cheeks goes upward, okay, symmetrically, equally. If one side cheek is going upside and another one is coming downside, means that is asymmetrical. Okay, asymmetrical cheek upwarding means that is called our asymmetrical smile. So it occurs in the facial palsy or Bell's palsy. Okay, and cornea of the mouth get droops at the paralyzed side. Okay, drooping of the cornea of the mouth, very important clinical manifestations of the Bell's palsy. Okay, you can consider here. And one very important nursing responsibility I have told in patient with the Bell's palsy, that is the close the eye with wet gauze to prevent the cornea ulceration. Okay, very important. Here it comes the uh, facial nerve, and next part of our nerve, very important, that is the vestibulocochlear nerve, that is the pure sensory nerve. Okay, pure sensory nerve. See, we are having the two part here. One is vestibulo and another one is cochlear. Okay, so you know that vestibule, our part of the inner eye, that is responsible for the balance, and cochlea, that is also part of the inner eye, that is responsible for the hearing. Okay, so here it comes our beautiful structure of the vestibule. This is our vestibule. Okay, and here this round is our cochlea. Okay, this is our vestibulocochlear nerve. This is vestibular branch of the vestibulocochlear nerve, and this is the cochlear branch of the vestibulocochlear nerve, which supplies the vestibula and cochlea. Okay, this nerve is responsible for, very important, balance and hearing. Okay, balance and hearing, very importantly. Okay, next, cranial nerve, that is the cranial nerve number 9, that is the glossopharyngeal nerve. So mixed cranial nerve, this is also, this is having the one sensory branch, and one is the motor branch. Okay, sensory branch, that is I have already told, which is responsible for supplying the posterior one third of the tongue, that is for taste. Okay, anterior one third of the tongue is supplied by the facial nerve, and posterior one third of the tongue is supplied by the glossopharyngeal nerve. Okay, this is the facial nerve, that is the cranial nerve number 7, and here is our glossopharyngeal nerve, that is the cranial nerve number 9. Okay, so both nerve supplies, and you will get the different type of the taste, that is the bitter taste, sweet taste. Okay, while studying the GI system, we study related to the tongue, where are the particular taste buds are present. Okay, which part of the tongue is responsible for which type of the taste perception, we will study there while studying the GI system. Okay, so this is our glossopharyngeal nerve. Okay, which supplies the two part of our in the GI tract. That is, one is glosso means tongue. Okay, glosso means tongue, and pharyngeal means pharynx. Okay, very important. For pharynx, it supplies the motor, means the movement of the pharynx, and tongue, which is a sensory. Okay, so for not for movement of the tongue, only for movement of the pharynx. For movement of the tongue, there is another one nerve is there, that is the 12th cranial nerve. That one is called hypoglossal nerve, that is responsible for the movement of the tongue, not a glossopharyngeal nerve. Okay. For glosso, it supplies only sensory nerve. Okay. Glosso means the tongue. Okay. Glossitis, that is the inflammation of our tongue, like this. Okay. Very important. And motor branch is supplying the pharynx. Okay. So responsible for the movement of the pharynx. Okay. Next, very important topic, that is cranial nerve number 10, that is the vagus nerve. So this is vagus nerve, also mixed nerve. This is also having the sensory and motor branch. Okay. Longest cranial nerve is the longest cranial nerve is the our vagus nerve. Okay. And which is having the sensory branch. So I told this one as a mixed nerve. So which is having the sensory branch which supplies our pharynx, that is responsible for our gag reflex. Very, very important. Regarding the gag reflex, gag is the like return coming reflex while touching to the our posterior part of our oral cavity, where there is a stimulation of the vagus nerve is there. Very, very important point. Keep remember in your mind. So in which all of the patient we will check the gag reflex? Yes, in post anesthetic care unit, patient which all are returned from the general anesthesia will check for the gag reflex before giving any food, because the gag reflex is responsible for the diverting the food in our GI tract and avoiding the food get enter into our respiratory tract, which prevents the aspiration. Okay. So if the patient came in the post anesthesia care unit without assessing the gag reflex, we have given some fluid, means any food, means it directly get enters into the respiratory tract, which leads to the aspirational pneumonia, which leads to the death. Okay. Very important. So we have to assess the gag reflex in the patient which all comes from the general anesthesia. Okay. And it supplies for the larynx also, and which supplies the very important our GI tract, especially in our stomach. Okay. Sensory branch which supplies our stomach. Okay. Which is responsible for the releasing of the HCl. So while studying the Zollinger-Ellison syndrome, and very importantly for peptic ulcer diseases, this gastric ulcer we will study. Okay. There we have studied the vagotomy as a management of the gastric ulcer. So gastric ulcer ಆಗಿದ್ರೆ ನಾವು vagotomy ವೇಗಸ್ ನರ್ವ್ ಯಾಕೆ ಕಟ್ ಮಾಡ್ಬೇಕು ಸರ್ ಅಂತ ಕೇಳಿದ್ರೆ, so vagus nerve is responsible for increasing the HCl production. When we do the vagotomy in the peptic ulcer or gastric ulcer, there is decreases the production of the HCl, so there is no further peptic ulcer. Okay. Because of that, we will cut the vagus nerve where that is called vagotomy. We will do in the peptic ulcer disease. Okay. And it supplies the external ear also for only sensory function. Okay. Only touch functions. Very important. And motor branch of our vagus nerve which supplies the GI muscles. Okay. Which is responsible for the peristaltic movement. So actually peristaltic movement is under autonomic nervous system, means it is not in our control. When there is a sympathetic nervous system get activates, okay, GI system motility get decreases, and when there is a parasympathetic nervous system get activates, our GI system activity get increases. It is reverse of the all thing. Okay. GI system is reverse of the all thing for the ANS. Okay. When our sympathetic nervous system get activates, of our each and every function increases except the GI tract function. Okay. Our pupil get dilates, our muscles will get increased blood supply. Okay. Our heart rate increases, respiratory rate increases, everything increases in the sympathetic nervous system, but GI motility is decreases. Okay. And when the parasympathetic nervous system activates at that point of the time, so our GI motility increases, rest all thing like heart rate decreases, respiratory rate decreases, people get constrict, like this. Okay. So very important point, and which is our parasympathetic branch of vagus nerve. So here in the CVS I'm explaining really only important points. Okay. For some patient which where we are checking, see I will tell on clinical questionnaire. while checking the rectal temperature to the patient with the thermometer. When we insert thermometer in the rectum of the patient, so we need to assess the heart rate of the patient. Why? Very important. Why? Because there is a highest chance of stimulation of the vagus nerve. If vagus nerve gets stimulated means which is a parasympathetic nerve. Okay, parasympathetic nerve. So which leads to the bradycardia. Okay, that's what we have. We need to assess the heart rate while checking the patient with rectal temperature, and while doing the suction also, if we touch the carina, that is the right and left bronchi get dividing here. So if we touch this point means this is called carina. If while doing the respiratory suctioning we have touched this carina means, so there is also highest chance of stimulating a vagus nerve. There is a also highest chance of the bradycardia. So parasympathetic branch of vagus nerve that is responsible for in cerebral cardiovascular system, which leads to the bradycardia, and in respiratory system which leads to the bradypnea, and in GI system responsible for the increased peristaltic movement. Okay, that's called hyperperistalticity. Okay, and increases the HCl secretion. So when you do the vagotomy, there is decreases the peristaltic movement, and so decreases the HCl production, which leads to the control of our peptic ulcer disease. Okay, very important. And next cranial nerve comes that our cranial nerve number 11, that is the spinal accessory nerve. Okay, so which is a pure motor nerve which supplies our very important point, that is trapezius muscle and sternocleidomastoid muscle. Okay, sternocleidomastoid muscle which is coming from our sternum, and yes, from our sternum to clavicle, yes, cleo, and clavicle to mastoid. That is the mastoid. Okay, that is called sternocleidomastoid muscle. Okay, sternocleidomastoid muscle. Okay, that is the responsible for the neck turning. Okay, turning of our neck. Which muscle is responsible? Our sternocleidomastoid muscle is responsible for turning the neck right, turning the neck left. Okay, so that nerve is that muscle is supplied by our motor nerve, that is the spinal accessory nerve, and this is our trapezius muscle. Okay, here it comes our trapezius muscle, which is responsible for shrugging of our shoulder. Okay, upward, downward, upward, downward movement of our shoulder. That is called shrugging of the shoulder. So, which nerve is responsible for the shrugging of shoulder means that is the spinal accessory nerve. Okay, very important. So, it supplies the sternocleidomastoid muscle responsible for neck turning, and it supplies the trapezius muscle responsible for shoulder shrugging. Very important point regarding the spinal accessory nerve. Okay. Next, we will move for the 12th cranial nerve, that is the hypoglossal nerve. Hypo means downward. Okay. Glossal means tongue. So, it's supplying the tongue from the downward. Okay. Which is responsible for the movement of the tongue. Very important. Okay. Which is responsible for the movement of the tongue. That may comes in your direct exam. Okay. Keep remember this one. Very important point here. So, which nerve is responsible for the sensation of the tongue in the anterior two-third part is, that is facial nerve, posterior one-third is our glossopharyngeal nerve, and movement of the tongue is managed by our very important nerve, that is the hypoglossal nerve, that is the pure motor nerve. Okay, so here it comes our end of the today's topic, that is the cranial nerve. So this video finds information for you means, please do subscribe my channel and hit the bell icon and like button, so you can get the further notification related to my video. Thanks for watching the video completely. Please share the video with your classmates, juniors, seniors. Okay, thank you so much.